So let's discuss in detail heat stress and all the first aid treatments that could be done for any kind of heat illness or heat injuries. So the first thing you have to remember is the cooling is key, and you have to know the symptoms and treat that patient accordingly. So before discussing the details of each of that heat illness, things you have to know. The first is that the heat illness can strike quickly and you have to learn to recognize the symptoms and treat it accordingly. Second is that the workers with heat illness should stop working and should be transferred to a cooler area and should be given fluids. Now, the altered mental state can be a sign of heat stroke and requires immediate attention. Now, when treating severe heat illnesses, cooling is the first priority. Now here is a sketch of all type of heat illnesses that we will discuss in this video in detail. So let's discuss them one by one. Now of all those heat illnesses, the most less severe is heat rash or prickly heat. Here our patient will have red clusters of pimples or small blisters. We can treat our patient by transferring him to a cooler or less humid environment. Also, we have to keep the area of the rash as dry as possible. We can apply powders on it depending upon the comfort of our patient, but we do not recommend using any kind of creams or ointment as they may impair cooling. A warm and moist skin can make the rash worse. Now the second type of heat illness are the heat cramps. Here the patients will have muscular cramps, pains or spasms in the muscles of the abdomen, arms and legs. Now we can treat him by giving plenty of fluids every 15 to 20 minutes. You have to avoid the salt tablets. Also get medical help if your patient has any kind of heart condition or is on a low sodium diet, or if the muscle cramps do not subside within an hour. Now, the third and the more severe form of heat illness is heat syncope or fainting. Here the patients will have the symptoms of fainting, dizziness or lightheadedness after standing or suddenly rising from a sitting or the lying position. Now how can we treat them? We have to sit down your patient or lie him down in a cool place after the beginning of the symptoms of dizziness, faintness or lightheadedness, and you have to give him plenty of fluids. Now the fourth and the more severe form of heat illness is heat exhaustion. Here the patients will have the symptoms of headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, elevated body temperature and decreased urinary output. Now you have to call for medical help or take your patient to a medical facility for evaluation and treatment. You have to stay with your patient until the help arrives. Until then, remove the patient from the hot area and transfer him to a cooler and less humid area. Give him plenty of fluids. Also, remove unnecessary clothing including shoes, socks, etc. And cool your patient with water, cold compressants, ice baths or fans, and also encourage frequent sips of cold water. Now the last and the most severe form of heat illness, which is also often fatal, is heat stroke. Here our patient will have the symptoms of confusion, altered mental state, slurred speech, loss of consciousness. Also with that, hot and dry skin or profused sweating, and in some patients in later state due to dehydration they won't have any sweats at all. Also they will have seizures, high body temperatures. Now how can you treat this patient? This is a medical emergency and you have to call for emergency care immediately. You have to move your patient to a cooler area and remove his outer clothing. You have to cool down your patient with water, cold compressants, ice baths or fan. You have to circulate air around your patient to speed the process of cooling, and also place cold, wet clothes or ice on the head, neck, armpits or the groin area of your patient to cool his temperature down, and stay with your patient until the emergency medical service arrives.